My name is Margaret Gallagher. I'm a general adult psychiatrist based in Dublin South East. And what that means is that my job is to diagnose and treat a range of mental illness, but also mental health difficulties. So there can be lots of different signs that somebody is developing psychosis, and I suppose we would break them down to changes in their behaviour and how they interact with the world around them. Some of the signs people might notice is that the person becomes more quiet or withdrawn, that they might be distracted in themselves, or that they might be responding to things that other people might not see. Commonly people might, be seen speaking to themselves or speaking to things that other people don't see, maybe seeing things that other people don't see, or have, noticing strange tastes or smells. They also might have ideas that other people don't share, that people might find bizarre or unusual, or might not be plausible. And these symptoms usually impact on their ability to function and live their everyday lives. There are some behaviours, unfortunately, that do increase our risk. So as a psychiatrist, one of the most problematic behaviours I see are recreational drug use and alcohol use. So particularly any drugs like cannabis, cocaine, amphetamines and stimulants can be very problematic and increase somebody's risk of developing psychosis. So avoiding those behaviours, but also, engaging with their lives, not isolating themselves, continuing with things like employment or courses can be protective as well. So approaching these conversations can be difficult and challenging for family members. I think anything that I suppose any words that might be stigmatizing, like perhaps mad or it's all in your head, can be very unhelpful. And again, just coming back to approaching things with empathy and in a non-judgmental way. So there are lots of right ways to do it, but certainly anything that stigmatizes the behavior or further isolates the person can be harmful. I think it's really important to remember that for lots of people with psychosis, this is a really frightening experience. So approaching it non-judgmentally, showing the person that you care, and not dismissing the person's concerns are really important.